Hold on.
There we are. All right, and I'll go ahead and introduce you whenever you guys are ready.
You go right ahead. We are
All
thrilled to
right.
be here.
All right. Well, good morning, everyone. Thank you all for joining us on December's Brunch and Learn, our last one of 2023. Today, we have Grace Brown from the Cook Center for Human Connection. Grace is a dedicated advocate for nationwide mental health. She joined the Cook Center with expertise in implementing strategies for student achievement. As an implementation and professional development expert, she's coached teachers in over 800 classrooms across the United States and crafted the My Life is Worth Living mental health web series curriculum that countless educators and administrators have implemented. Joining her today is her cohort at the Cook Center, Jenna Trowbridge, and they will share the services and experiences of partnering with schools, districts, and organizations across the United States to bring mental health resources to communities, including their work in North Dakota. So during the presentation, you guys know the drill. Please submit any questions you have in the Q&A feature, and I'll do my best to get them in as we go, or we'll answer them at the end. I'll hand it over to you guys now.
Thank you so much, Taylor. And as you see
Thank you.
those Q&As come in, please don't hesitate to stop myself or Jenna throughout the presentation. And so we can address those, or at least let people know that question is going to be addressed coming up. So, thank you again for that wonderful introduction. I'm thrilled to be here on behalf of the Cook Center for Human Connection this morning, of course, along with my amazing colleague, Jenna Trowbridge. So let's dive in. I wanted to welcome all of you. Thank you all for being up early with us on this holiday week to really dive in and look at and come up with some solutions around mental health. Today, I invite you all to really use that Q&A feature. I may even ask you to type some things in throughout the session so we can make this super interactive. So, one of the things that we often hear is it is time to sound the alarm when it comes to youth mental health. But really, we are beyond sounding the alarm. We have to go beyond that, and we've got to think bigger, and we've got to innovate because we are in a youth mental health crisis. And I know you all know that. So, with that being said, let's get started and dive in. I always like to show everyone just some of our partners who we are working with across the country. The Cook Center is a nonprofit organization. We work with schools all over the country. We have some free resources. We have some contracted resources. But our main goal is to help educators, help parents, help their children. And we do that in lots of different ways. And of course, partnerships is a huge thing in that process. So as we go through today's session, I want you to think about how you might recreate this session for your own teachers, principals, staffs, counselors. So please put on your student hat, take lots of notes today, because I want to help you build your mental health army today. Speaking of a mental health army, it does take partnerships like what you're seeing on your screen. And we work with with wonderful partners like AASA, the school board, the School Superintendents Association. We work with folks like NSBA. We work with folks like Mental Health America, the JED Foundation, NEDA, Feeding Hope. We work with 988, the Suicide and Crisis Lifeline. And my first question for you today, my first quiz for you today is, do you know what 988 is? I'm sure many of you are aware our nation has a suicide hotline. And what they have done is about 2 years ago, they remodeled. So instead of that big, long 10-digit number that people have to remember, now if somebody needs to get in contact with a guide at the suicide hotline or a mental health professional there, all they have to do is dial 988 anywhere in the country. And what I want to ask you today is, did you know that? And then what I want to ask you is, do you think every single principal, counselor, staff member, teacher knows about 988? Do your students know about 988? The other thing that I want to stop and talk about here real quick is that 988 is a suicide and crisis lifeline. They've actually remodeled it. So not only is it for a parent to call if they're worried about their child that they might be suicidal, or a student to call if they're feeling suicide, ideation. But it's also for anyone to call if they're going through any mental health crisis. So that's the first thing I want to make sure you are all aware of, and that hopefully you can share with your own staffs as you start to build, like I said, that mental health army. So, like I said, we have to go beyond the alarm, but let's talk about sounding the alarm. And I'm going to have Jenna help me read off some of these quotes. I'll start with the first one, Jenna, and then you can go from there. So this is what we're seeing. These are the headlines we're seeing across the nation. Poor mental health in US teens exasperated by negative experiences during COVID-19 from CNN.
Yes, the American Psychological Association says kids' mental health is in crisis. Here's what psychologists are doing to help.
It's life or death, the mental health crisis among US teens, says the New York Times.
And teens' mental health distress could be worse than CDC data suggests. And that's from the Wall Street Journal.
You guys, I have about 5 slides that are filled with quotes like this from our media outlets from across the country. And what's exciting is that it's being recognized in the media, and it's also being recognized at the highest level. But we have to take it off of the newspaper page and really start to innovate. One person that is really leading the charge of innovation as it comes to mental health is our very own U.S. Surgeon General. And this is really good news for us as educators. Um, our Surgeon General, he is sounding the alarm. He is aware of what's going on, and he has given us as educators kind of a pathway of his vision on how we can start the process of solving this crisis. Let's hear from him.
Can you unpack for us some of the challenges you're seeing at the moment when you look at what young Americans are facing in terms of their mental health?
Yeah, I'm deeply worried, Paige, about the mental health of young people in America right now. We're in the midst of a crisis, and we have been for many years, even though it hasn't always made the headlines or been top of mind for people. But what COVID did is it really pulled back the curtain on just how severe the mental health epidemic is in the United States, particularly among youth. And there are three numbers, Paige, that always stick in my head. One is the number 11. That's the number of years it takes on average for a child to receive treatment after developing symptoms. The second number is 57. That's a percentage increase in the suicide rate that we had among kids in the decade prior to the pandemic. And this got worse for a number of kids during the pandemic. And the other number that I remember is 42%. That's a percentage of high school students. 44%. That's a percentage of high school students who say they feel persistently sad or hopeless. And think about it. We think of high school as a time where your life is opening up for you. But nearly half of high school kids are feeling despondent about themselves and about the future. So these, to me, stick in my head because they give me a snapshot of where we are. And it's echoed by the conversations I have with young people all across the country who routinely tell me that they are struggling with anxiety or depression. Many of whom also tell me that their experience of social media often leaves them feeling worse about themselves and about their friendships.
All right. So, what do you remember? What do you remember? What did you hear from Dr. Murthy? What did you hear that you're remembering? Go ahead and put it into the chat. I want to see what stood out for you in his quick talk there. And then Taylor or Jenna, if you want to just tell me a few things that are coming into chat, maybe just 2 or 3, that would be awesome.
All right, everyone, don't be shy now.
Can you unpack for us some of the
Oops, I have that going twice. So a few things that I heard and I'm sure are coming into chat is the number 11. The number 11. Does anyone remember what the number 11 represents? It is the number of years it takes on average for a child to retrieve treatment after developing mental health symptoms. These are national numbers. And so what that means is that means if a child is in first grade right now, they might be a senior in high school before they are receiving treatment. And that is a big gap. This is from kind of those first symptoms, and this is getting into a professional that can help, like a therapist or a psychologist or, so forth. 57%, that's the percent increase in suicide rate among kids the decade prior to the pandemic. And let's talk about why, between 2010 and 2020, why did we see a 57% increase in suicide rate among children? Well, I want you to think about where you were in the year 2008. Wherever you were that year, that's the year you ended up with this in your hand, this cell phone, and that cell phone was connected to the internet as well as social media. And what we've seen is since children have had that connection to social media, we have seen a hockey stick effect in mental health. And what that means is instead of data rising kind of in a normal fashion, we are seeing a huge uptick in anxiety in youth. We are seeing a huge uptick in depression in youth and a huge uptick, unfortunately, in suicide in youth. And since the pandemic, these numbers have not gotten any better. But when a parent or a teacher asks you, what is this anxiety thing? Why are kids having anxiety? I didn't have anxiety in my day. I want you to steal that story, explain to them, say, remember in 2008 when you got connected with this? Well, that's really when we started to see anxiety, depression, and suicide rates just rise to the point that now we are in a mental health crisis for youth. The other number that he mentioned was 44%. That is the percent of high school students who say they are persistently sad or hopeless. And since the recording of the little interview you just saw with the Surgeon General, that number has gone up. It's looking closer to 67% is what we're seeing on national average as we're looking at mental health data. About 67% of high school students now in the last year, that number has gone up a lot, are saying they're feeling persistently sad or hopeless. And there's a lot to that. So with that being said, let's talk about students. Let's talk about what students are going through. I want you to make a guess in your head about how many students do you think are in this picture? What do you think? And Taylor, since you're on with us, I'll let you shout it out. What do you think? How many kids do you think are in this picture?
I'll just say 120.
120. There are actually 500 kids in this picture. So we're looking at 500 children. And let's take a look at what this picture represents. You are seeing that there is one adult in this picture, and this adult represents the recommended number, the recommended ratio of school psychologist to children. So our national recommendation is 1 school psychologist to 500. Think about if you feel like you're shocked by that, if you feel like, yeah, that seems like that would work. Just take a moment and consider. The recommendation in this country, though, is 1 school psychologist to every 500 children. But let's now talk about the children. 30% of these children will consider suicide. Consider why. 60% will experience persistent feelings of sadness and hopelessness. 16% will make a suicide plan, and 9% will attempt. So as you can see, that is a lot for that school psychologist, which again is why we have to put our heads together today and really think about how we're going to build our mental health army, how we're going to expand our forces. You know, now that we have kind of looked at kind of the national average, I wanted to take a moment and look at what's going on in North Dakota. And Jenna's going to come on and just talk with us a little bit about some of this data going on in your state. Jenna, take it away.
Thanks, Grace. So this is from the 2021 Youth Risk Behavior Survey from North Dakota. The next one we know will come out here in the next year or so. So these are the students who reported their mental health was not good most of the time. So as you can see in that 15, 16, 17, 18, male, female, and the total. So you can see female is higher at 15, 16, 17, but almost 45% of females are reporting at 16 and 17 and 18 that they're not good most of the time. That's your sophomores, juniors, seniors. And then even with males, we're seeing 15 to 20%. So your students are coming to school already feeling kind of in a slump for that day. The next one is students who seriously considered suicide. So we're talking for females 15 and younger, almost 25%, males almost 15. And again, this is right from the Youth Risk Behavior Survey. I encourage you all to take a look. But then you can see just as a whole, we're almost nearing 15% for males and females for that. And then students who made a plan. So of those students who considered, nearly 20% of those students made a plan. For females, males closer to 10, but then we see that jump for males as we get up 16, 17 years old, females as well. So just noticing that students in North Dakota kind of fit into that same national average and even a little bit higher in some areas.
Thanks, Jenna. It's so important that we are looking at these risk behavior studies. And as we go back to the conversation about school psychologists or lack thereof, you know, I told you 1 to 500, that is the recommended national ratio. But the reality is only 3 states in the union are making that national average. You're seeing those on your screen now. It does get worse. These states that I just put up onto the screen, these are 1 to 1,000. So 1 school psychologist to 1,000 students. The next group of states that I've just added, they are looking at a factor of 3. So 1 to 1,500 students, 1 school psychologist to every 1,500 students. In the states that just came onto the screen, which include North Dakota, we are looking at 5 times the amount. 1 school psychologist to 20 to every 2,500 students. And then finally, you know, we've got states that are 1 to 10,000, and, you know, we've got California that's not even reporting, right? So what this tells us is that we have to think outside the box. We know as superintendents, we know as school leaders, we know as school boards that we are lacking resources and even school psychologists, right? If we wanted to fill every single role in this country that was available for a mental health advocate in schools, it would take 7 years to fill those roles. If starting today, you know, kids came out and said, I want to be a counselor, I want to be a school psychologist, I want to be a social worker, right? It would take 7 years to fill all of those roles. And the reality is we simply don't have 7 years. So the big question here is, how do we get kids one-to-one support? Who do we bring to the table? Every child has someone in charge of their care. Some adult is in charge of their care. For some, it's a mom or a dad. For some, it might be a grandparent. For some, it is an aunt or an uncle. For some, it's even a sibling. For some, it's a foster parent. And for some, it is maybe even the state. But every single child has an adult who is in charge of their care. And it's important that we educate these adults on this mental health crisis and give them some simple tools to help when things get rough, or when they start to worry about their children, when they get that feeling in the pit of their stomach that something may not be right. And it's so important we do that, because then instead of 1 to 2,500 students, we are looking at ratios of 1 to 1, one parent to one student. I'm sure a lot of you know this, but 80% of families rely on schools for their children's mental health needs. And here's the thing, parents expect schools to lead with solutions to their kids' mental health. End of story. This is not necessarily the case if a child breaks their arm, right? Or has some sort of infection. But when it comes to mental health, parents are looking to schools. Parents are actually 10 times more likely to access mental health services for their children through schools. But as you can see, the need far, far, far is outweighing the resources. In Dr. Murthy's little talk with us, he mentioned 4 things. He mentioned more access. He wants us to reduce barriers and increase access to services. He mentioned more people. We have to increase our workforce of people who can provide and deliver mental health care. And, we already know how difficult it is to find like a school psychologist or a counselor or a social worker. And so one of the ways we can do that is educate parents. He talks about schools, and he is committed to investing and encouraging schools to invest in prevention programs when it comes to youth mental health. And he thinks those should be school-based. And he talks about stigma, shifting our culture so that no one is dealing with this terrible stigma on mental health. He says we have to start talking. We've got to start sharing our stories as it relates to mental health. So, people that have already started that, or districts that have already started that in North Dakota, are listed on the page now. These are districts that are truly at the forefront of starting to follow this message from Dr. Vivek Murthy, and they have all placed a mental health medallion on their website to help lead families to mental health resources. We're going to dive in a little bit deeper about what that means in just a minute, but I did want to give Jenna a chance to just comment on these partners we have in North Dakota.
Yes, thanks, Grace. So Grace is wonderful. She is on our impact team, and my kind of role here at the Cook Center is to be an advocate to school and community leaders. So my work here and time spent partnering with these districts really has grown over the last year, meeting some folks at national conferences, hearing about our work through CREA, coming out of Minot, just hearing those things, we have grown to provide supports. We will share about what those are and how we've implemented supports in those areas, but we do have a presence in North Dakota. Unfortunately, we're not in Grand Forks today to have some chippers. I keep telling Grace we have to go, but we are there and we do visit, and we are spread out across the state.
So, whether we are talking about children in North Dakota or children across the country, what our Surgeon General is saying is that there are millions of children struggling right now, and they can't wait any longer. And so what we're here to do today is to talk solutions and to help you build bridges, to no resources, so that families don't have to wait 7 years or 11 years, and that we're not seeing, you know, this huge population of our youth feeling sad and depressed and hopeless. So, that's really why we have come together here today. And that's really what we do at the Cook Center for Human Connection. I mentioned we're a nonprofit. We're focused on suicide prevention and mental health supports in schools. And our goal is to help educators, help parents, help their children. That is what we are here for. And so, again, these partners in North Dakota, they are already on that path to helping their parents help their children through these mental health resources I'm about to provide and share with you today. I'm going to share with you resources today that are absolutely always at no cost to a family. So every single resource today is never at cost to a family. That is huge, because what that does is that deals with the access issue that Dr. Vivek Murthy talked about. We have to make it available. And one of the ways that we do that is through our on-demand courses. So through parentguidance.org, we have 50 on-demand courses that anyone can access at any time. You could send it to your sister-in-law in Nebraska today and she could start using it, right? Or you could send it to a parent that's sitting in your office. So those are amazing. We've got over 50 courses. We've got a place where you can have folks actually ask a therapist, ask a clinician questions, and that is available. Another thing that we do to support mental health in schools is we partner with schools to bring topical mental health series to their communities and parents. And so if your district is dealing with a lot of self-harm, a lot of suicide ideation, maybe motivation, maybe you have students that are not coming to school and you're worried about school avoidance. What's happening is school districts all across the country are partnering with us to bring topical mental health series to your families. And these are anonymous sessions to your families that they can join and be a part of for an hour. It is virtual and completely anonymous. It's super, super important because we know that a lot of times people aren't accessing these mental health resources because of the stigma associated with them. They don't want to tell anyone. And so bringing these mental health series to kind of address difficult parenting challenges or difficult times that families may be going through can be really, really helpful. And then the other thing that we provide is parent coaching. So at any, you can partner with us to bring your district parent coaching. And that means at no cost to the parent ever, anytime, you can say to any parent, in your district, even you can partner with us to provide this for your staff as well, but anyone at any time to say, you can go to parentguidance.org, you can click parent coaching, and within 24 to 48 hours, you can be connected with your very own mental health coach that can guide you through whatever is going on in your life. And people can set up virtual calls, they can message their coach. And again, that's always at no cost to the parent. It's something that, districts and the Cook Center partner on to make that possible. So that's really some of our resources. And I think, Jenna, I'm just going to go live into the site really quick and show people what they can expect, if that's okay with you.
Yeah, and when we go back, I want to, because I know that we have a little bit to share just about the series and coaching, and I can share that with you all. A couple of things I just want, as we've been talking about this, as we share solutions, as Grace is about to share parent guidance, there are 4 A's that I like to bring up. My work is solely kind of focused on rural. Grace knows that is my jam. If we can go somewhere 3 flights, I'm in. So the kind of when I talk to districts, I want them to think about accessibility. So what does it look like when we're trying to find source kind of resources? Availability. So once we found that resource, next step, how long is the wait? Okay, I can schedule an appointment. Next step, affordability. And so now we've gotten to the third step. Does that family have insurance? Can they afford to drive? Can they afford to take time off work? And the fourth piece is the acceptability. So when other families in your community find out that they've scheduled this appointment, they can wait as long, they're waiting that 6 weeks, they can afford it. What does that look like in your community? So as we shared partners, these conversations are exactly what I had with them, and saying, I know I came from a small town, I know what car was in the parking lot at the grocery store to see a friend whose mom was there too. So we know who's getting help in those services in town. So when we're thinking, I just want you all to think, what does accessibility look like in your area? Affordability, acceptability, and availability. So just some thoughts. Go ahead, Grace.
Jenna, thank you so much. I think those are such important points. I'm also from rural America, rural Idaho, and we've had situations in our family, Jenna, where, we have been maybe able to get an appointment after months and months, but then, we were 2 hours to Boise, Idaho to connect with somebody, or 3 hours to Salt Lake City, and finding the time, the financial resources was a huge, huge stressor as a family. And so those are some of the things we're trying, those are some of the barriers that through parentguidance.org we are trying to solve. So we mentioned we mentioned our on-demand courses. So I want you to think about this year. Have you had a safety meeting with a child, had to create a safety plan? Have you had a crisis meeting with a child and family? What does that parent feel like when they leave? Would it have been helpful to say, hey, you can go to parentguidance.org and there is a course on bullying that's been done by a national expert, so that you can learn a little bit more. Or, hey, there's a course on self-harm. There's a course on anxiety. There is a course on how to help your child through grief and loss. So these are just some of the on-demand courses that you can start accessing right now today. We also have Ask a Therapist, and so that is where anyone can come in and submit a question to our clinical team. Let me tell you who our clinicians are. We're working with national experts, folks like Dr. James Mazza. He's the leading suicidologist in this country out of the University of Washington. We're working with folks like our clinical director, Dr. Kevin Skinner. He's been in the family therapy field for over 28 years. We are dealing with Harvard psychiatrist, Dr. Melissa Lopez Larson, who is an expert in child psychiatry, as well as she has some big experience in trauma and bullying. We're working with folks like Jenna Ramirsma. If anyone's seen that Disney movie Inside Out with the feelings, that's all based off of research called internal family systems, and a lot of that research comes from Jenna Ramirsma. So these are the folks that we are working with and who are answering these questions when folks submit them. And we get all kinds of questions. Here's a question that was submitted. My 16-year-old son has developed such high levels of anxiety that he's unable to attend class or do any scroll work, and I just don't know what to do. And
Hey, everybody. We have a question today that
I'm not going to play it all, but you can see it is so easy. Those questions, not only was somebody able to submit that question anonymously, but also our clinicians are going to respond to that and post those responses so that we can all benefit. So next time you're with a parent and they're leaving and you're feeling like, gosh, that I feel so bad for this parent. I don't know what they're feeling or thinking. Think about sending them either an on-demand course from parentguidance.org or finding a question that might meet their needs that they can watch on their own time. The other thing that we do is we have parent coaching. So parent coaching is something that we can provide through partnership, where any family in your district can get connected with a mental health professional within 24 to 48 hours. It's super simple. Once we have created a partnership, families that need to talk with a parenting coach simply click get started. And then they find their state. We'll just do Arkansas because it's right at the top. And then they would find their district. And from there, they are simply able to quickly register. It takes about 5 minutes. And then within 24 to 48 hours, get connected with a mental health coach. So those are just some of the resources and a little bit of a tour through parentguidance.org that Jenna and I wanted to give you today. But with that being said,
Will
we're
you jump,
going,
sorry, can you jump back to PowerPoint, Grace? Sorry about that.
yes. Yep.
I'm sure you were going to, but I'm
Uh,
glad you pointed out that parent coaching. I wanted to share a little bit more about just the resources we have. We talk about our partner districts, what districts are doing. All of our partner districts have the medallion on their website. So anyone that you saw there, their families get emails about the resources that are available at no cost. This medallion right here. If you go to Northern Cass, I just looked this morning. If you go all the way to the bottom of their page, you can see it on the district site itself. So some of our districts access the no-cost resources for everyone. Some of our districts access what we call our mental health series. We thought of that MTSS triangle. This is that next step. So some of our districts will offer those mental health events. They are virtual, they are online. We create materials for districts. So as a district reaches out and says, we have a lot of students struggling with anxiety, or we're having a substance abuse vaping problem. They reach out, we schedule these. I have some districts who will do once a month, every 2 weeks, but this is an online space where families register. They scan that QR code you can see right there, and then they join us for an hour on screen, no faces, kind of the same setup, but we do show responses on screen, just no names. And then districts can offer this as a parent engagement, family engagement, a staff engagement, or just something for the community, but to educate on a topic. So
yes.
that's one piece. Yes.
So, again, this is amazing because this is meeting the needs of your district on a community level, right? If you're seeing in your community that parents are really struggling with vaping or really struggling with bullying or social media, that's these courses that we can bring to your community, and they're just amazing.
Yes.
Jenna, do you want to dive into some parent and staff coaching as well?
Yes. So this is where our partnership with Korea, a lot of our districts you saw in that central region, please excuse my map, but those districts are accessing what is called parent coaching, even over to Northern Cass. So I shouldn't excuse everyone over back east, but this resource allows families and staff to access a coach online. So as Grace showed you that parent coaching tab, they sign up with us. We don't collect insurance. We don't ask for payment from a family, and we don't send a bill to a district. So a district pays a one-time fee. We're talking a small amount in most of my rural, small-sized districts I've in North Dakota. So those families reach out within 24 to 48 hours. They get their first session. So as a family struggling, maybe they came to a school board meeting, maybe their child's struggling, they're not in alignment with the way the district's looking at how to handle some of the needs of their child, or they need more help themselves to understand. They can go right on here and someone can say, hey, let's get you signed up for this. The district doesn't get any names. The family knows it's a safe space. And then they get to meet with their coach every other week, every week. Again, no cost to them. It is a mandated reporter. They are trained coaches that work under Dr. Skinner. So they are matched with the coach to meet their need. And what I love is we've developed this with districts. They said, well, my staff actually needs more help. And maybe it's not just about a child or parenting. So now we have coaches that are trained kind of under a different umbrella, but they focus on whether it be grief or helping them navigate a relationship or divorce, or maybe they're struggling with substances. This is a space they too can reach out and get that same response. They get a care team coordinator who helps them stay on track. They get an app face-to-face. They can message their coach 24/7 and get a response that next day. So when they're not in school in the summer, they're needing support on the weekend, they can get some help. And again, this is all for parents. So as we, as school board directors, as school board members, SEL is a frightening thing, and it's been a long couple of years. This is not in any way meant for your students. This is all choice driven and meant for staff and adults. So when they need help, this is here. It's also in English and Spanish. So as I was just talking to a district outside of Fargo, we have families who move into town and then leave. This is a service that can be offered to those Spanish speaking families. Same with our mental health night, or excuse me, our series. So this is another resource. This, I will share, is one of my most successful in terms of the series or coaching. We have nearly 20 families in Northern Cass. We have families in West Hope and Wilton and Underwood, Dickinson, in these spaces, Solon, in these spaces where we can't get resources, we see families signing up and engaging. So again, we provide data to districts, we provide everything they need, but families are never charged. And we're talking in some of my rural districts, $5,000 a year covers everyone in the district. So this is a resource. It is completely anonymous, safe, HIPAA protected, mandated reporters so that go right to your local agency. So again, we're talking about school boards. This liability is on them to go out away. This is not a district. This is something we take care of on our own. So just another service that we provide. We talk about those A's. We just talk about seeing the accessibility and availability, no long drives, no long waits, no worry about their financial situation. All of this is available to them. So I will share that again at Northern Cass, that's through Korea, some resources. If anyone's curious who is using that service, please feel free to ask us. But another way to get support for your families as they're struggling to help their child.
Yeah. Jenna, I'm so glad you were able to dive into that. It is so important. And I know you and I are just so passionate about getting people these resources, especially as we ourselves, right, are from very rural parts of this country and know the struggle of getting these resources. So we talked about those on-demand resources through parentguidance.org, those courses, the Ask a Therapist. We talked about those topical mental health series, and of course, we just talked about parent and staff coaching and how that can benefit a family next time you're meeting with somebody and they're struggling with you, or just simply sitting at the baseball game or basketball game and somebody says something is going on, how powerful to be able to point them in the direction of a parenting coach at no cost that they can get connected with in the next 48 hours. On top of that, we also have amazing resources for teachers. And we often hear from teachers, I am dealing with so much mental health issues in my students, but I don't feel like I have the training. And so we have a huge menu of mental health professional development specifically designed for educators. And that's something that we can bring to your school on site or even do virtually. One of the kind of not to miss sessions is QPR. QPR stands for Question, Persuade, Refer, and it is the 3 steps that somebody might need to take to save somebody's life when it comes to a mental health crisis, either suicide ideation or a mental health crisis. And this is something that we can certify teachers in, and they leave feeling empowered and like they're really ready when and if they are dealing with a student that might be dealing with a mental health crisis. They kind of feel like they know what to do and ask. We have 15 other sessions on trauma and self-care and understanding mental health, understanding anxiety, understanding bullying. Like we have so many, but just wanted to highlight some of those. So if you're looking for something to kind of kick off the conversation around mental health or continue the conversation around youth mental health and community mental health, bringing some of this professional development to your district is always a great option. Jenna, do you want to share anything about this?
I wanted to just share QPR is something most of you are familiar with. It is one of the accepted kind of trainings for the North Dakota suicide prevention requirement for teachers, staff, administrators. So aside from QPR, one of the things we've heard is that teachers are just needing some extra support around helping as we've implemented services, or we've just brought in the no cost in really helping to break that stigma. And what does that kind of look like, and how Grace spends time with your staff working not just on the mental health of parents, but their mental health. So I really can't speak enough about the work that her team does in helping your staff. They feel the burnout, they're tired, they're addressing the same issues over and over and over. And our team is here to help them feel a little bit better and help them have some conversations that are challenging. And sometimes we don't have them because we're trying not to say the wrong things. Grace's team can help. So
Absolutely.
thank you, Grace.
Absolutely. So, I'm just going to leave you with a quote from a superintendent over in Montana, so just right next door to you all. He says, oftentimes the school system is putting up resources to several children from the same family at different grade levels, when it would be more efficient to provide support to parents as well. That is just so well put, because we've got to often get our parents support so that they can be there and be support for their children. So with that being said, we want to help you get this medallion up on your page. Jenna, I'll let you kind of talk a little bit about that.
Yes, we'll leave
So
the QR code. If you scan this little medallion, again, Northern Cass, if you just Google them, click their district, scroll to the bottom, you will see a medallion. All that does, it doesn't capture information. It just is a point of reference so families can find parent guidance easily. And then we also send you an email that you can send out to families, letting them know what this resource is. But get this on there so all families know, okay, this is the resource I have when it's 12 o'clock at night, or their student came home and said, I had an issue today. This is a space they can go. So if you fill this out, I will just get in touch with you and share that. If you, I'll also, I think the next page has my email. We'll share that in a minute. But you can scan this, fill out your information, and we will get that to you.
okay. I've actually just typed your email into the chat here, Jenna. Jenna Trowbridge at cookcenter.org is her email. So if you're like me and you're like, I don't want to scan a QR code, I just want to email, you've got that email right there for you as well. We are here to take questions about any of our resources that we talked about today. Are there any questions? Is there anything we could answer at this time?
There's a period in my email now. Sorry, not to throw a curveball.
What? There's no period?
There is in
Oh,
between my name. Sorry.
yeah. I'm
Yeah.
sorry. I'm sorry, everyone. Yes, there is. I'm so sorry. Jenna Trowbridge. So important.
Yes.
Mine is also Grace Browns. I don't know why I struggled with that.
It's okay.
Anyways, let's are there any questions? Any questions?
Happy to answer on any current implementations, anything we have going on, share any information.
And you might be typing those in. So in this, what we'll do is we will pass the mic back over to Taylor, and we'll keep a lookout for your questions in chat.
Yeah, we'll give it a couple seconds here if anyone else has questions. Sometimes questions come in after too. So, with that being said, want to thank you guys for being on with us today to share this really valuable information. I think something that we have failed to do is put these resources even on our own webpage. And so we're excited to do that. We're excited to have Cook Center as a resource on our webpage. And so you'll be able to find all this information, some other kind of documents, and the Gals' email on our events page under Brunch and Learn. Another thing that we'll be doing this afternoon is I'll be emailing all of this information as well. So please feel free to contact them if there's no questions right now, but maybe later on. I think not. Oh, there is one maybe. All right, Nikki says the chat is disabled, so that might just be on
Oh,
my side of things there. But what a mind-blowing presentation. Thank you. Thank you, Nikki, for sharing. Really was. We're
fantastic.
excited
And
to share.
I'll just reiterate Jenna's email again since I put it in incorrectly. Jenna.trowbridge at
Yes.
cookcenter.org, and she'll get right back to you if you'd like to discuss further. All right.
Great.
Thanks, everyone.
Thank you, everyone. And just a reminder, our first Brunch and Learn topic of 2024 in January is on parliamentary procedures, presented by Anne-Marie Campbell from the Fargo School District. So we hope to see you online at 9 a.m. on January 17th. Have a great rest of your week. Happy holidays, everyone. Safe travels. Jenna, safe travels home. And
Yes.
Grace, you as
Thank you.
well, if you're doing the same.
Thank you.
Thank you again. We
Wonderful.
really appreciate having you on, and we look forward to sharing this information. So
Happy
Thank you,
holidays.
Kayla.
everyone.
hey, happy holidays, everyone. Thank you.
Bye.